Hand hygiene. Hi, Mrs. O'Neill. How are you?
Good.
Good. Well, good morning. My name's Sarah. I'm your student nurse. I know Cindy, our LPN, just came in and got your 8 o'clock vitals, but I'm here to do your medications. Is that okay? Okay. Can you just verify your name and date of birth for me?
My name is Jennifer O'Neill. My birthday is January 2nd of XX.
Perfect. And I see you have an allergy alert. Is there any allergies I need to be aware of?
Ibuprofen.
Ibuprofen. Okay, perfect. And how would you rate your pain this morning?
Like a 2.
Like a 2? Okay, that's perfect. Is that an acceptable pain level for you? Okay. So what's going to happen this morning is I'm going to come in and give you your heparin. It's supposed to help prevent blood clots. I'm going to give it in your stomach since it is a subcutaneous injection, okay? Okay. I'm going to go gather my supplies and I'll be right back, okay?
Okay.
Okay. Hand hygiene. So now we're in the med room. We're going to check her MAR and see her heparin order. So I'm going to log in. All right, I have my correct patient, Miss Jennifer O'Neill, birth date 12XX. The only allergy she let me know about is the ibuprofen. That's the only one I'm seeing here on the computer. Here is her heparin order. She's ordered heparin 5,000 units, subcutaneous every 12 hours. She is due for her first administration at 0800, which is what it is now. She's not received this medication before, so we know that the every 12-hour range, this is an appropriate time frame. So now we're going to move into our supply closet with the computer system here so we can make sure we pull the correct med. Since we're giving her heparin, I want to make sure I'm picking a 25 to 30 gauge, 3/8 to 5/8 needle for our subcutaneous injection into the abdomen site. So here's all my needles laid out here. I am going to choose this needle. It is a 27 gauge 1/2 inch needle, and it is still sealed, so we know that this is a safe, untouched medication, and it's saying the expiration is 8/31/24, so I know that this is an appropriate supply to choose. And then I need to choose my heparin. 10,000 units per milliliter. My expiration is 10/20/23. This is a single-use container. I'm going to move back over to my MAR so I can compare it. So I have heparin, 5,000 units, and this is a 10,000 unit per 1 milliliter. And we know for heparin, in order to withdraw a medication, we have to convert to milliliters. So our 5,000 units is the equivalent of 0.5 milliliters. So we're going to draw up 0.5 milliliters out of our vial. Expiration 10/20/23. All right, so I know I have the correct medication. Now we're going to take our WOW and we're going to move into the client's room. Hand hygiene. Hi, Mrs. O'Neill. It's Sarah. I'm back again for your 8 o'clock heparin injection. How are you feeling?
I'm good.
Good, good. Can you just confirm your name and date of birth for me?
My name is Jennifer O'Neill. My birthday is January 2nd of XX.
Perfect. And I see you still have your allergy alert bracelet on. That's good. Can you just confirm that it's only the one allergy you let me know about earlier?
Yes, it's ibuprofen.
Ibuprofen. Okay, perfect. And that does match what we have in the computer record, so that's perfect. All right, so what I'm going to do is I'm going to get my gloves ready. I just want to inspect the injection site so I can make sure this is a proper injection site. It is going to be given in your abdomen, okay?
Okay.
Can I move down the blanket? Okay. Might be a little chilly. So I want to avoid the area 2 inches around the umbilicus and the belt line. So I'm going to look in this area over here. I see no redness. Does it hurt when I palpate like this?
No.
No. Okay, perfect. All right, this looks like it's going to be a good area. Let me get my medications ready. Here at the bedside table, I have my syringe, my medication, I have my gauze, and I also have my sterile cleaning pad. And so before I even start anything, I'm going to do my second check. Heparin, 10,000 units, 1 milliliter. Expiration is within range. Going to compare it to my MAR. Heparin, 5,000 units, so I'm going to give 0.5 milliliters. And we're confirming that we have Jennifer O'Neill. So that was my second check. Now I'm going to get my medications ready. Open up my syringe. Remove my cap. I'm going to put it in my vial. No, I'm not. I'm gonna get my air equivalent to 0.5 milliliters. Here, I'm going to put in my needle, expel the air, tilt my container up, and I'm going to withdraw 0.5 milliliters of the heparin right here. 0.5. Withdraw my needle, and I'm going to put it aside here so I can clean the site. Okay. Alright, so I have my alcohol wipe here. I'm going to clean in a firm circular motion, and I'm going to allow it to air dry, and I'm not going to blow on it or wave my hand, anything like that. And just don't touch this site, Mrs. O'Neill, okay?
Okay.
Okay, perfect. We're going to put in the trash here. Alright, Mrs. O'Neill, before I do your injection, while your site is drying there from the alcohol swab, can I just get your name and date of birth so I can scan it into the MAR?
Yes, my name is Jennifer O'Neill, and my birthday is January 2nd of XX.
Perfect, Mrs. O'Neill. Scan. Ding. Let me scan my medication, and I can confirm that I have exactly 0.5. Ding. All right, since I've just withdrawn my heparin into my syringe at 0.5 milliliters, we're inspecting for no air bubbles. We're also going to make sure that the needle itself is not bent in any way. I'm going to compare the medication I have just withdrawn for my third safety check to the MAR. So I have heparin, 5,000 units, subcutaneous, so 5,000 units is going to be given at 0.5 milliliters, and that is how much I have withdrawn from my syringe. All right, and before we administer, we made sure that we checked with hospital policy, and we realized that no aspiration is necessary. All right, Mrs. O'Neill, we just did our third check. We know that we are ready to go for our medication administration. Are you ready? Okay, our alcohol swabbed area looks nice and dry. You may feel a slight pinch, okay?
Okay.
And just remember, this is our heparin. This is what you're getting to prevent any kind of blood clots while you're here at the hospital, okay?
Okay.
So I'm going to use my non-dominant hand. I'm going to grab the area. I'm not necessarily pinching. I'm just making sure the area is nice and supported. I'm going to go in at a 90-degree angle. Inject. Now, with my hand that's holding the skin, not pinching the skin necessarily, but I'm bunching it and holding it tight. I'm going to stabilize the bottom of my needle so I can move my dominant hand up to the top with my plunger. I want to inject at about 10 seconds per milliliter. So since we have 0.5 milliliters, I'm going to inject at about 5-second rate. 1, 2, 3, 4, 5. Right? And I'm going to withdraw the needle without changing the angle quickly. Perfect. All right, Mrs. O'Neill, how was that for you?
It was okay.
Okay, just a slight pinch, right?
Yes.
Okay, perfect. All right. See? All right, there's no bleeding. Just make sure you don't massage that site. We want to avoid any damage to the underlying tissue, okay?
Okay.
Okay. Now I'm going to activate my safety needle and dispose of my sharps into my sharp container. I'm going to throw away the rest of the materials. Take off my gloves. Correctly. Throw them in the garbage. Hand hygiene. Go over to my MAR, and I'm going to initial, and I'm going to type in my site of administration. Perfect. All right, Mrs. O'Neill, is there anything else I can do for you while I'm in here?
Nope.
We can get you all tucked back in. Here's your call bell. Make sure you just ding if you need me, okay?
Okay.
All right, perfect, Mrs. O'Neill. We'll come back and check on you later. Gonna take all my materials with me out of the room. Hand hygiene on the way out.